Those of us who have walked addiction, we have traversed a path that has been full of a lot of darkness, pain, and suffering. To get to the other side of that means that we have a story to tell.
More than 20 million Americans have substance use disorders, and overdose deaths are continuing to rise. Programs and treatments aren't designed based on what matters to people with lived experience. So services aren't always responsive to individual needs, and many don't achieve the best results.
I'm a person in sustained recovery from a substance use disorder.
I'm a woman in long-term recovery.
I'm a person in long-term recovery from both a substance use disorder and a co-occurring mood disorder.
I am a person in long-term recovery.
The current model of treatment and recovery is essentially a treat and street model. An individual presents themselves with a substance use related emergency, they're treated for the emergency, and they're put right back on the street to repeat the cycle.
I've been in detox over 50 times.
With every other health condition, there's multiple different treatment options. And if you don't respond to the first one they give you, they don't say that there's something wrong with you. They say that's not the right treatment for you.
I was suffering and I couldn't figure out how to stop.
So often treatment has been deciding for individuals and patients what the outcome should look like.
The existing way is sort of like, all right, everybody come this way. We're all going through this door right here. And what if that door is not for me? Not for a lot of people like me.
We're at this turning point where we need to make a decision. How are we going to really help people?
How do we move to a place where we're asking patients now, what are the outcomes you want to have?
So that's what we did. Community Catalyst, with help from Faces and Voices of Recovery and the American Society of Addiction Medicine, conducted the first national study that asked people what matters to them. We engaged a group of 10 people in recovery to guide us, and we heard from nearly 900 others across the country through a survey and focus groups.
Voices from diverse communities were represented, not only ethnic and cultural diversity, also LGBTQ identities, and then geographic diversity as well.
But then we also had formal surveys that we sent out to figure out how could people get more of what they needed.
So often the system decides what success looks like, but this, I could tell from the start, was about helping us to define what success looks like for us and what health looks like for us, and empowering us to get there.
So much of the current treatment model by design has been supportive of a very white middle class. Addiction and substance use, it does not discriminate. It does not care about race or class or gender.
We asked people with substance use disorders, what are the outcomes that matter to you? Hundreds of people spoke up, and here's what we learned.
The very simple first response that seemed to be almost universal was just simply staying alive.
Enhanced quality of life.
Reducing harmful substance use, improving mental health,
Increased access to basic needs.
and then increasing that self-confidence, increasing those community supports.
Priority outcomes were also different across race and gender. For example, Black and Hispanic people in the survey prioritized taking care of basic needs more than white people. The report recommends ways to reshape the services, research, and policies that we need to better address the national epidemic of addiction.
There are more than 20 million Americans with a substance use disorder. We've interviewed just about 900. For as many people as there are in recovery, there are recovery solutions. So we need to continue the research.
We need researchers to find out what services best achieve the outcomes individuals want. And it's very important to look at differences by race, gender, to help make services better and more equitable.
Policymakers need to understand that a full continuum of services that includes everything from prevention to harm reduction to treatment services, recovery supports, the funding of that continuum of services needs to be robust across the board.
And when we talk about harm reduction services, We mean things like overdose prevention sites and programs, naloxone distribution, and syringe service programs that focus on keeping people alive.
For service providers, it will mean really working with patients, talking with patients, taking the time to actually understand what it is that is important for them within this framework of staying alive, increasing quality of life, and improving mental health and self-esteem, and reducing their substance use.
Everyone needs to come together to address inequities. That means policymakers, providers, community members all need to pull together. We need to provide effective service across cultures and languages, treat addiction as a public health issue, and address structural racism and discrimination.
What that means is that we really need to think about a treatment system that is integrated with addiction specialty treatment services, mental health treatment services, medical services, peer recovery support services, really making sure that people can have safe and supportive housing, employment, education.
We can save the next generation some of the heartache of addiction if we can invest in recovery now.
We have all the building blocks now. We really now can take the next steps that are so necessary.
I want to live in a world where we get to see a lot more of what recovery looks like.
To learn more, please visit communitycatalyst.org.